Well, studies show that one quarter of people with COPD downplay their condition, and two-way conversations are proven to be key to successfully managing COPD. Here to share more on understanding COPD symptoms is Dr. David Mannino, University of Kentucky Professor of Medicine and former Chief Science Officer for the Centers of Disease Control and Prevention's Air, Pollution, and Respiratory Health Branch, along with Candyce Norris, who is currently living with COPD. Thank you for joining me today.
Thank you, Makiba. And actually, and to clarify, I'm currently a respiratory medical expert working at GlaxoSmithKline. Those are my previous positions.
Okay, thank you so much. Doctor, in your experience, what have you found to be reasons why patients are hesitant to open up about their symptoms to their doctors?
Makiba, there could be several reasons for this. First, that they may not understand that the symptoms that they are having are related to their lungs. Sometimes patients just figure, oh, I'm getting older, and this is normal for people that are getting older, but it actually is not. Sometimes they're embarrassed by these symptoms, and then for example, if they've been a smoker, and they may feel that this is something that they sort of brought on themselves, and Candyce can address this when you talk to her shortly. So there are lots of different potential reasons, and often, for example, patients as they start developing respiratory symptoms start doing less and less. So if they go into their physician and the physician asks, well, do you get short of breath when you exercise? They say no, but they don't really exercise because they're too short of breath to do it. So I think that there are lots of potential reasons, why this occurs, and we're trying to sort of get this educational effort out, to really have patients, better understand what's going on in their bodies and have this discussion with their physicians.
Exactly. Now, regarding the discussion with physicians, how important is it for healthcare providers to know the severity of their patient's COPD for determining management strategies?
Well, this is an important component because the way physicians and other healthcare providers will address COPD is to really understand, the various, symptoms that the patient's having and the risk factors, and then be able to really put together a comprehensive plan. That includes, for example, if the patient has certain risk factors, such as cigarette smoking, if they're still smoking, or if they're working in an environment where they're exposed to dust or gases or vapors, that this is something that needs to be addressed. Patients with COPD are more susceptible to infections, so they should be sure to get their vaccinations for influenza and pneumonia. All patients with COPD should have an exercise program, either a formal one, such as pulmonary rehabilitation, or an informal one, where they're just taking steps to be active every day. And there are various effective therapies that really need to be tailored to what's going on in an individual patient, and all these components really need to be addressed in our patient population.
Thank you for sharing that information. Candyce, share a little more about you and your family's experience living with COPD.
Living with COPD can be very challenging. I was diagnosed in 1996, so I've obviously had a lot of experience with it. I didn't take it seriously in the beginning, but eventually I absolutely had to. I had to open up with my doctor, I had to involve my family, and I had to start managing the disease and no longer let it manage me. There's resources out there available for you to look into it. One of the best is copdfoundation.org, and you can just get a lot of information, and it's going to help you walk down the path you need to go.
Absolutely. Now, how would you describe your symptoms to someone who doesn't realize that they may have COPD?
One of my most difficult symptoms was the extreme short of breath. It can be like trying to inflate a brick when you're breathing, which is frightening and it's very difficult. And that's something that you really need help with when you're at that level. That's when your family comes into play. That's when they can either get you to the hospital or call the ambulance, whatever is needed. And that's when you also have to be honest with your doctor. It's only going to help you. He's not there to judge you. He's there to help and provide a great treatment plan for you.
Absolutely. Now, speaking of treatment plan, you mentioned earlier about managing the condition instead of letting it manage you. How did being more open about your symptoms improve your individual treatment and to help you manage it better?
Well, because if the doctor doesn't know all the symptoms you're experiencing, he can't treat it properly. I couldn't tell him that I'm just tired without also adding, I have extreme short of breath, because there would be a different level of care, which is necessary. So I listened to my doctor about starting to exercise when I was ready, and that's what I did. And so it's made a world of difference in my life.
Thank you for that. Now, what advice would the two of you like to give to people living with COPD as well as their caregivers, not only to encourage that open conversation for management, but also just living with it on a day-to-day basis to help them manage it on their own, away from their provider?
I always tell my patients that our primary goal is to not only add more years to their life, but to add more life to their years, such that they're able to do, all the activities that people would love to do as they get older. Be able to go on vacations, enjoy these major life events like weddings, graduations, of their children and their grandchildren, and our real goal is to really ensure that our COPD patients can do all those things. So, and to get to that end, that the patient really needs to be well informed. So again, to reiterate, what Candyce had mentioned, the website of the COPD Foundation, which is copdfoundation.org, provides information for not only patients, but also for caretakers and for physicians to really maximize the care of our patients with COPD.
Great. Thank you so much for that. And again, for more information on the management of COPD, visit copdfoundation.org. Thank you so much for joining me, Doctor, and best of luck to you, Candyce. It's been a pleasure.
Thank you,
Makiba,
Makiba, for having us.